Listen, the CDC is just updating its mask guidance. Good news, most of you can ditch them. But of course, there is a catch. The agency says they're only recommending you get rid of your mask if COVID hospitalizations are low where you live. Do I have to tell you this is a big deal? It's a big deal, right? Because it's a place this country has not been in for a while. The last time the CDC changed its mask guidance was back in July. But now you have COVID cases going down pretty dramatically. All but 3 states are seeing a drop of at least 25% of new cases. Check out your screen. Take a look at where we were a month ago. We were seeing something like 750,000 cases a day. Now look at it, 75,000. Hospitalizations are also down 44% across the country in the last couple weeks. So the agency behind the scenes, based on our reporting, has been working for weeks to come up with new guidelines. And their announcement comes, I don't know, if you look at what states are doing, a little on the later side, because already we've seen states around the country dropping mostly their mask mandates. Dr. John Torres helps break down this new guidance from the CDC. Dr. John, do what you do so well and plain English it for me. When do I need to wear a mask indoors and when don't I? How do we know this?
And Hallie, first off, you're right, because they did last do the recommendations back in July. But at that time, they were using cases as metrics, cases and positivity rates. Well, now fast forward to this time frame, and what they're saying is it's really hard to use cases as the metric because Omicron has kind of put a wrench in those works. And so instead what they're looking at is hospitalizations, and they're looking at the amount of beds in hospitals that are taken up by COVID patients. In other words, what's the pressure in the hospitals, and using that as the metric. So what they're saying here is they're dividing it into 3 groups, low, medium, and high. If you're a low and medium group, for most of us, they're saying you do not have to wear masks indoors. Medium, if you're high risk, talk to your doctor about whether you should be wearing a mask anyway. But when you hit that high area, that high area of risk because of the hospitalizations and the beds that are taken up, they're saying that everybody should start wearing masks indoors. And so that's the big difference, the metrics they're using, and they're giving us a little better guidelines along the way. And I think if you look at it, the one big thing to remember is we are still 74,000 cases. We are still 1,700 deaths a day, unfortunately. But the big change here is the fact that over 70% of the country has some immunity to COVID. And the fact that this Omicron seems to be a little less dangerous than the other variants, and that's certainly helping out, Hallie.
I have to thank John, Dr. John. I'm candidly, I'm hopping on a flight later tonight, and I will be wearing a mask because that is what you do on planes, right? Because there is a mask mandate for federal transportation. It expires in a few weeks, I think middle of March. You now have this flight attendants unit that is pushing back, saying, you know, they want that to be extended, basically. Is it too soon to talk about masking on planes, masking on trains, et cetera?
You know, I think it's too soon to a certain extent for a very certain reason, and that's mainly because of what's happening on the international stage. You know, internationally, and it's hard to separate just domestic flyers happening domestically and those coming in from other countries. And in other countries, the mask mandates around the world are on airplanes everywhere, on public transportation, pretty much everywhere. And so I think that's one of the reasons we need to keep it here. Plus, it's hard to judge who's on their vaccination rate, who is staying on there, even though they're sick. You know, those can cause problems. And you are in close quarters, both at the airport, on the airplane, or at the train station and on the trains. And so I can see them pushing that back a few more weeks or a few more months until we get these cases even more under control, and then possibly doing the same thing of the low, medium, and high risks for flights here. But again, remember, this is a global stage we're working on. And globally, there's still a lot of COVID out there. And so we need to make sure we protect ourselves around the world.
Generally, Dr. John, in your professional opinion, you think the CDC is making the right call here when it comes to changing up the mask guidance?
I do think they're making the right call. Number one, because people are a bit fed up with wearing masks. We've been doing it for 2 years. And so I think they're getting that message as states and localities are starting to saying mandates can be withdrawn. And so they're pushing it to the local level, which I think they need to do, but giving them good, hard guidance, saying, here are the specifics, here are the metrics, and here's what we think you should do with those metrics. And so I think that's going to help a lot, both in getting people not have to wear masks as much, but also realizing when they do need to put them on.
Dr. John Torres, thank you very much for that breakdown. It's great to see you.
Thanks for watching our YouTube channel. Follow today's top stories and breaking news by downloading the NBC News app.